Well, hello, I'm Mark Jensen. I'm a professor of rehabilitation medicine at the University of Washington in Seattle, and I study chronic pain. My research program, which has been active for well over 30 years, focuses on understanding how to treat chronic pain and the mechanisms that underlie the treatments that we have for chronic pain. Most of my research focuses on hypnosis merely because it's the most effective and the most interesting for me to study. So I conduct clinical trials looking at efficacy. I then conduct trials to look at how is it that that hypnosis works and for whom it works. And so a good deal of my time is spent writing grant proposals, writing papers, writing books, and organizing interventions to be tested.
Okay, that's thank you very much. That's perfect. And now for your masterclass, you're gonna be talking for almost 3 hours. How are you planning to structure that masterclass? If you have any idea.
Yeah, so the master class, the goal is to give the participants a basic understanding of pain, how the brain and body work together to create the experience of pain, and what evidence that we have regarding how hypnosis impacts those different processes. As it turns out, there's no pain center in the brain. In order to experience pain, the brain pulls together information from all over the body, information about memories. It processes this information and then makes a determination. Is the person at risk for experiencing physical damage? If the person is at risk for experiencing physical damage, according to the brain, it creates pain to guard you, to protect you from that damage. Pain is not an input. It is not something we sense. It is something we create. Much like we create anxiety to protect us, to put us into a state where we're ready to protect ourselves. And given that the brain creates pain, any treatments, anything that affects the brain can affect our pain experience. And in the first half of the workshop, I'm going to explain these processes, and I'm going to review evidence regarding what hypnosis does to each of these processes. And based on that, we can develop hypnotic suggestions that will focus on each of these processes. And the bottom line is that as clinicians, we shouldn't just give one suggestion for pain because that might target only one process. We want to understand what are the factors that are contributing to this person's pain. How is this person's brain creating pain? And with that understanding, we develop suggestions that will target the areas of the brain and body involved in that person's experience. And overall, then that will increase our efficacy. So the first half of the workshop it will be to explain this, to demonstrate or illustrate the evidence about this. And then the second half is going to be more practical. I'm going to talk about my very favorite hypnotic inductions for managing pain, based again on this model of how the brain and body create pain, and then give the participants a chance to practice those. Because I think it's very important that once you learn something, you practice it right away so that you'll have it locked in yourself. And then I'm going to model a whole session about how I would interview somebody to understand the factors involved in their pain, negotiate a series of hypnotic suggestions for them to manage their pain, and then how I would do a session to address that. The overall goal is to give participants an understanding of pain, how hypnosis relates to that, and how they can use this information practically to help improve pain outcomes in their patients. And my hope is that the day after the workshop, people will be able to immediately apply this so that their patients will be able to obtain more comfort.
Okay, thank you very much. That was really clear. And it sounds super exciting also. So finally, how would you market your class to someone who isn't sure which one to attend? Because they're gonna have to choose between all of
Yeah.
them.
Well, first I would I wouldn't necessarily market my class because I want there to be the best match between the participant and the workshop they attend. So I would suggest that they read the description and then probably trust their gut. Their gut probably knows pretty much which workshop is going to work best for them. So I would think it's pretty straightforward. If they're not sure, and that's possible because I'm sure there's going to be many workshops that are fantastic. I would invite them to quiet their mind and then ask themselves the question, which one? And then just go to the first one that their subconscious gives them. That's what I would do.
That's
Okay.
what everybody should do. Okay, that's great. Thank you for answering these questions. That was really clear, and you gave us everything that we need. And
Okay.
really can't wait to have you. Thank you for doing the effort of coming to Bordeaux. You must be really busy, and we really appreciate that effort. And we're really honored actually to have you.
Well, that's very sweet.
We really
I'm
are.
honored.
We are.
Uh,
Thank you very much.
Thank you.
Okay.